We all know that in America today, tragically, obesity, diabetes, and high blood pressure is on the rise with young Americans. If I was a school board member, I'd try to find out what the school lunch program is. I'd try to see if there isn't physical education mandatory for all the students in some way. We need education programs. We need the Surgeon General to be engaged in it. We need the President's Council on Physical Fitness engaged. And we need to educate Americans, because if we continue on this trend of unhealthy children in America, there's no way we're going to ever be able to provide available and affordable health care to all Americans. The final important principle of reform is to rediscover our sense of personal responsibility. We must personally do everything we can to prevent expensive chronic diseases. Our rights in this country are protected by our personal sense of responsibility for our own well-being. Cases of diabetes are going up, not only in the baby boom generation, but among younger Americans. Obesity, diabetes, and high blood pressure are all on the rise. Parents who don't impart to their children a sense of personal responsibility for their health, nutrition, and exercise, vital quality of life information that political correctness has expelled from our schools, have failed their responsibility. Also, parents are responsible for ensuring that their children are covered with health insurance, if, as is often the case, many options are already available to them. Research shows that coordinated care, providers collaborating to produce the best health outcome, offers better quality and costs less. We should pay a single bill for high-quality health care, not an endless series of bills for pre-surgical tests, visits, hospitalization and surgery, follow-up tests, drugs, and office visits. Paying for coordinated care means that every single provider is now united on being responsive to the needs of a single person, the patient. Health information technology will flourish because the market will demand it. Clinics, hospitals, doctors, and medical technology producers, drug companies, and every other provider of health care must be accountable and their transactions transparent. Families, insurance companies, the government, whoever is paying the bill must understand exactly what their care costs and the outcome they received. Families place a high value on quickly getting simple care and have shown a willingness to pay cash to get it. If walk-in clinics in retail outlets are the most convenient, cost-effective way for families to safely meet simple needs, why should government stand in the way? I will not. If the cheapest way to get high-quality care is to use advances in web technology to allow a doctor to practice across state lines, then let them. In disasters like Katrina, we saw how stupid and harmful it is to refuse the services of doctors just because they had an out-of-state address. We should have a national marketplace, and if I'm elected president, we will. There are 5 major diseases that consume 75% of healthcare costs in America. If someone has diabetes, we should give the healthcare provider a certain amount of money and say, care for that patient. And if at the end of that period of time, then, and that patient is well, we'll give you a reward, rather than every test, every procedure, every MRI. And we need walk-in clinics, and we need community health care, and we need incentives for home health care as opposed to long-term care. In my state of Arizona, we adopted a proposal which incentivizes health care providers to keep people in home health care settings, dramatically less expensive than long-term care. In Arizona, we have 1/2 the number per capita of people in long-term care facilities as the state of Pennsylvania. Incentives to keep costs down, Charlie. There are no incentives in the system today.